So basically, peripartum cardiomyopathy, what I discussed from the I'll briefly discuss from Williams textbooks some important point definitions. The development of cardiac failure, the development of cardiac failure within in last month of pregnancy or within 5th month of postpartum. The criteria for peripartum cardiomyopathy: the absence of an identifiable cause for cardiac failure or absence of recognizable heart disease prior last month of pregnancy, and there will be left ventricular systolic dysfunction that should be demonstrated with classical echo, including decreased ejection fraction, fractional shortening along with left ventricular etiology usually unknown. The most common cause viral myocarditis, abnormal immune response to the pregnancy, aberrant response to greater hemodynamic burden of pregnancy, hormonal interactions, and malnutrition. Apoptosis. The pathology, there will be two hit hypothesis. The first hit, genetically susceptible, that is TTNC1, TTN star 3. Second hit is 16 kilodalton protein fragment pasoinibin cause myocardial damage with clinical apparent ventricular dysfunctions. This would be worsened by high level SFLT1 anti-angiogenic factor and pro-angiogenic factor. Most of the women symptomatic after the postpartum. Management peripartum role LMWH when ejection fraction is 30 to 35% because the increased risk of left ventricular thrombi, and you should avoid breastfeeding. Bromocriptine will cause left ventricular systolic function restoration one study. 50% will recover left ventricle within 6 months. This rate of recovery is slow usually in obese women. Recovery depends on the baseline LV and diastolic diameter. If ejection fraction less than 30, then less than 40% will recover. If ejection fraction more than 30, then 90% will recover up to 1 year. The mortality is 5% to 10% if persistent cardiac failure. The precancerous one-third will relapse with history of PPNC with worsening of symptoms and deterioration of the IV function. The management, basically you have to reduce volume overload, afterload, rhythm control, inotropic support, beta blocker therapy, decrease mortality. So basically these are the key points from the Williams textbook 26th editions, or the basic point I have written. Please note it. Please subscribe if you like this channels.